So what we are going to do today is, have you done case discussions with anybody to this point? Okay, so it'll be a little bit different. Don't angst over it. I think it'll be a good preparation for the exam on Wednesday. What I'm going to do first is I'm going to give you a quiz. We're going. I saw that.
Oh.
We're just going to do. I think it'll just show where there may be, and they're simple. It doesn't count. It's just a polling quiz, like I'm assuming you all use those poll everywhere. Okay. So we'll do that, and then I'm going to ask you to move into your groups that you're assigned to, or we're going to do the discussion through group consensus. I think it's easier if you can talk to each other about the answers, and then we talk about it as a group. So it's a good reinforcing of learning. We talk about it individually, or we kind of test individually, then we talk about it in a group, and we talk about it in a large group. So you all may have to help me with this. This is the first time I've done this system here. So, let's see. Okay, so what I understand is you all text in your answers, yes?
There's some of us that put it on our desktop.
Well, okay, so however you do it, you can do that, okay. So, how can I tell, oh, I see the results. Okay. So the preferred daily medication for mild persistent asthma, or any age.
Oh.
How many are there? Are there 36?
35.
35.
Get on your laptop.
Yeah, she's
Can you log into your computer?
Okay, so now do I just advance the slide?
I don't know.
Okay, so why didn't it show me your results?
If you like scroll the mouse over to the side, little options will pop up.
Okay, like.
It's the eye.
The eye.
The eye. Show chart.
Yeah. There it is.
Okay, so low dose inhaled corticosteroid. Okay, so let's just walk through these because some of you chose different things. So the key words in here are preferred, daily, and mild persistent asthma and the age. Okay, so those are the things you have to clue into. Since it's for any age, it's not going to matter. So in terms of when you get to daily medication, what's your PRN medication? SAB, okay, so a short-acting bronchodilator, beta-2, always. So the first, in any of these, it's always an inhaled corticosteroid. It's the most potent anti-inflammatory drug. That is the main problem in asthma. It's inflammation of that airway. If you do not get it under control, you will never control their symptoms or their ability or their peak expiratory flow or their task of daily living, ever, okay? Now, there are times when you can't use it, so you would go to others because either the patient refuses or there's some reason why you can't use. I can't think of any major things that would prevent that. Sometimes it's just patient acceptance. So mast cell stabilizers. You could use them, but they are weak compared to the anti-inflammatory actions of a inhaled steroid. So the preferred, So in that chart, it's gonna give you preferred, and then it gives you second line choices, okay? Questions about this one? This is the time to do it, because I know you either haven't studied it or you're not familiar, it's okay. It just shows you. So, questions? All right. Okay, so this is the next one. So an indicator of very poorly controlled asthma would be the need to use an inhaled short-acting beta-2 agonist. How often? 1 to 2 nights per month, before physical PE every day, more than 2 times per week, more than once a month. I don't know how to do that.
The writing.
The writing?
So it's login.
Pardon?
So it's login.
Login. Tell me about this. Okay. Sorry, this is my,
You need to put an S at the end of it.
okay. I bet you I have to do this on everyone. Okay, so that's everybody, so then I have to do the eyeball. Okay. All right. The inhaled beta-2 agonists are your sentinel drugs. So what's a sentinel? What's a sentinel? If you're gonna post a sentinel, what are you doing? Pardon? A big event. Well, you're watching for a big event. Sentinel. A sentinel is a watch, someone who watches, a guard. So it's a sentinel drug in that it will always tell you. It's probably one of your best indicators that something is not right in the airway, always. Because people with asthma, when they have symptoms, they are going to go for that beta-2 because they know by experience that they are always going to get quick relief of their symptoms, usually. Okay? So the more symptomatic they are, which is usually related to either triggers, or it's exposure to triggers, or it is due to that inflammation in the airways, they're going to be more symptomatic. So the beta-2 agonist use will always tell you one of two things. One is their use of the drug may be really awful. They may just not have the technique right. But usually it's telling you is that they are not well controlled. So you always, always, always ask about beta-2 agonist use. You can do it by how often, or if you're having to use it every day. But the other thing you can do is how many canisters are you using a month? They should never be using more than 1 canister a month. Most canisters have about 200 inhalations in it per canister. Okay. So if you're looking at, if they're using more than 1, you know they're way over. If they're under 1, you don't know if they're still overusing it unless they can give you a good history. So the beta-2 agonist is your drug to look at. So then how many times a week? So the goal, so this goes to a goal and also goes to that sentinel action of the drug. So more than 2 days per week. So it isn't a lot, Okay. That's a must-know. Questions about that? Before physical exam education class, that's not wrong that they should be using it. It's just that the indicator for very poorly controlled. Okay. So that's the question, what the question's asking.
Is it 2 or more than 2, meaning 3?
It's more than 2.
Okay.
Well, I always have to, I always have to look at that myself. It's 2 or more.
So once would be well controlled. If I'm using it twice, it's not well controlled.
Let's see, they have it more than 2 times a week. More than 2 days a week. So, yeah, 3 or more. Okay, so questions about this one?
So if this, instead of saying very poorly controlled, had just said poorly
Doesn't
controlled?
matter.
Doesn't matter.
Even if it said just. It could say an indicator of well control, and it could say using it less than 2 days a week. Two or less days a week. Okay, so do I have to do this one? Okay, I don't know why that is wrong. Okay, so,
You have to unclick the I.
okay, so have y'all already answered? So it's already showed you the answer, right?
Well, if one person answered it, we don't know if they were right or not.
Ah. Okay, so which of the following classes of medications for asthma is a quick reliever or rescue medicine? Okay, so this one is what, 5, show chart. Okay, so your patients should always, you should ask them, what's your quick reliever? What's your controller? They should be able to tell you, no hesitation. The one that you would really be worried about is if they grab that long-acting beta-2. Okay, so they always should be able to identify those for you. You should ask when you see them. Show me your quick inhaler, or your quick rescue medicine. Okay, let's see if okay, don't answer this one until the next one, until I see if I've got it. No, so this one I need to do the eyeball to hide it. Okay, so you got nighttime awakenings 1 to 2 times a month and a daytime coughing or wheezing 3 to 4 times a week experienced by a 4-year-old is consistent with which classification of asthma severity? So daily symptoms, nighttime awakenings. Okay, let's see which ones. Okay. Well, the correct answer is mild. Yeah, I think so. Look at, get your chart out.
So she told us that we have to supervise those charts because they're given to us and having clinical on the workout, so that's why.
That didn't mean.
Okay.
So, she may say that, and I think there's some degree of that. I think you have to look at it. I think you have to have some idea of where these things fall. So you need to know, have some idea about nighttime awakenings, daytime symptom frequency.
So 3 to 4, I mean, that sounds like quite a lot.
It does.
This says able to sleep through the night.
There's very few.
Yeah, that
nights
doesn't sound
get
right.
on
I thought
nights
it's
without being severe.
And mild is 1 to 2 times.
No, that's not true. That's not true.
It depends on the matter.
Depends on the age.
Wait, what'd you say?
This chart says moderate is daily symptoms.
I guess daytime.
Yeah, this is like one activity, like you wanted to. But it depends on the person.
Good, so we need them on that chart.
Depends on age,
This
most,
is another thing on top
because
of
as
it.
their airways get bigger,
And there's a
they
difference between
won't have as many
intermittent
asthma problems.
Persistent. For intermittent, if it's any, then it's considered.
But these are
But
things you
for
would
the
need to be
persistent,
able, if you
it's
deal with a
1 to
lot of
2.
asthma, and if you're in a family practice, you will. If you see children, you will see a lot of asthma, okay? So the 3 things these are 3 of the things you would ask the beta-2 agonists use. Their nighttime awakenings and health, and they're having daytime symptoms. You're going to use it as to understand or see their advancement to goals, to know how well they're controlled and they're responding to the symptoms that, or the treatment that you have given them. I think it's easier if you learn kind of the middle of the road. You will see a lot of mild. You will see a lot of moderate because they just won't be well controlled, and then you can move them backwards. So picking one and learning the extremes on the other end, I think, is the easiest. You learn moderate, then usually severe is just a step up and mild is a step down. Okay. Okay, so which of the following medications should be avoided in people with active pre-existing anxiety, depression, or symptoms of psychiatric disorder? Just take a guess. Okay. Okay, good. It is, it's singular. It's one of those odd ones, those leukotriene receptor antagonists, a little bit less. So what, for inhaled corticosteroids, what's the major side effects of those?
Not jittery,
Say it again.
being jittery, right? And then-
Not the steroids. Yes, for the beta agonists. Yes. Thrush would be one. Most common is going to be a cough because of the way it'll be technique related if they're just using like a closed mouth technique. The short-acting beta agonists, so a jitteriness, increasing heart rate, hyperactive. Those would be cromolyn, very, very, very few. Usually it would just be a cough due to inhalation technique. I think I have one more. Let's see. Let me close this one. Hold on. Oh. Okay, well, I'll leave it open since y'all are already in there. Okay, so the way to reduce thrush is to use the spacer device and then rinse and spit. Okay. So that'll give you some kind of preview of the way I would ask those questions. Any questions based on these? Okay, so what I'd like you to do is get in your groups. I don't care how you arrange yourselves, but get in the groups that you're used to working with. I know
Faculty
it's
groups,
just
guys.
disturbing your.
Faculty groups.
Thank you.
What about just like how you study with your friends? Because I'm already studying.
Whatever works.
Could you move to the groups that you are faculty to assign? They told me you were in groups of like 5 or
That's
so.
our SP
You're
group.
SP group.
SP.
Oh, you're SP.
Thank you.
Okay.
Sorry.
Taylor, we're close.
Brad,
Yeah.
Do we just want to, like,
I don't like.
Well, Brad's going first.
where are you? I'm with RC.